Assalamualaikum everyone, welcome back to this channel. So this is me Arya Wahid, and in this video we are going to start the effects of endocrine system and what the drugs which are used when you have a disorder which is related to your endocrine system. So now first of all we are going to study a detailed anatomy of endocrine system, and after that we will move on to the drugs and all the disorders which occur in these processes. So first of all, let's discuss what is the endocrine system. So it is a system which is consist of your tissues and some glands. So these tissues and glands, they are helping in the production as well as in the release of specific kind of hormones which they produce by themselves. So actually what happens whenever a disease happens, these tissues and these glands make changes, and due to these changes a particular diseases happens. So in order to treat them, we will make the drugs which directly affect on these glands, and after that we can treat that particular patient. Now let's discuss that what is a hormone. We say that these glands are going to release the hormone. So let's discuss that what is a hormone, what is it. So actually hormone is a chemical that coordinates different functions of your body. So as your neural system is present, which is connecting and interrelating your brain with the various part of your body, helping in the movement and thinking and learning processes, same there is a hormonal or endocrine system in which the chemicals are produced, and they are controlling a lot of functions. And what are the functions they are controlling? Here I have given some functions. They are controlling the metabolism of your body, the lipid metabolism, fat metabolism, carbohydrate metabolism. All of these are controlled by hormones. Second, the growth of your body, the development of a child into an adult. So these all the changes happens due to these hormones. So whenever there is an imbalance of hormone, there is a disturbance in the growth of that child. So you have seen a child which have very short height. It is due to the deficiency of a hormone. Now the other is the reproduction. So the hormones have very important role in the reproduction. If there is changes in hormones, then you can have problems related to reproduction. Last is the sleep wake cycle. It is also regulated by your hormones. And last is your mood. The happy or you are, the more hormone it is. So now let's discuss what types of endocrine glands which are present inside your body. So these are some glands which are present, and they are releasing the hormones. So first is the pituitary gland. It is present in your brain. Second is pineal gland. It is also present in the brain, controlling the production of melanin. Melanin is a chemical which regulates your sleep and wake cycle. Then is thyroid gland is present in your neck. Adrenal gland is present above your kidney, and then is the parathyroid gland, which is just two opposite to thyroid gland. Now in our syllabus only pituitary gland and thyroid gland is given, so we will discuss only these two glands. So in that lecture we will cover all the hormones which are released by pituitary gland. Okay, so let's discuss some anatomy of pituitary gland. So this is very small gland, and its size is just like a pea. You see pea size, so its size is approximately a pea, not large than a pea. Okay, pea size. And then let's discuss its location. So it is present below the hypothalamus of your brain. So where the hypothalamus is present, below the thalamus. So below the hypothalamus, at the base of your brain, this pituitary gland is located. And this gland is called as a master gland because it is controlling all the functions. It is controlling the secretions of other hormones also. So it is controlling a lot of functions, due to which it is called as a master gland. Now let's discuss what are the lobes of pituitary gland. There are two lobes of pituitary gland: anterior lobe and posterior lobe. So as I am drawing the picture of it, so this is the actually the shape of your pituitary gland, anterior lobe and the posterior lobe, and here the hypothalamus is present. So below the hypothalamus, these lobes are present. Now let's discuss what is the mechanism and by which mechanism these glands, this pituitary gland is going to release a lot of hormones. So actually there are 8 hormones which are released by it. Now we are going to discuss all of these hormones. So let's start it. So here I have written that the mechanism of hormones by which they are released through your anterior lobe only. So here we will discuss only the hormones which are released by your anterior lobe, not from the posterior lobe. So the hormones which are released by posterior lobe should be discussed in the next lecture. So now here is your hypothalamus, okay, and here is your pituitary gland, not the pituitary hormone. This is your pituitary gland. Okay, now your hypothalamus has a great link with the pituitary gland. Okay, and how they are linked, you know very well about the hypothalamus. It is a main organ which is present in your body, and this its main function is that it is connecting a connection between your um, endocrine system and your nervous system. So it is connecting both of these main systems which are present in your body. So now it is also controlling the pituitary gland. It will sense the nerves, okay, when the stimuli came, of whatever the stimuli it is. So this stimuli is coming, sensory neurons came here. The hypothalamus sense the signals what is coming, and after that it will release specific kind of releasing factor. It will release a factor, and these are some factors which are released by hypothalamus. So it depends upon the stimuli which comes and what particular factor will release. It's depend upon the stimuli which came. Like consider, I am considering that a specific stimuli comes which tells the hypothalamus to release this factor. What is this factor? This is the corticotrophin releasing factor. RH is indicating releasing हार्मोन, ओके, रिलीजिंग हार्मोन, और सी से कॉर्टिकोट्रोपिन. ठीक है. सो अब आपके हाइपोथैलेमस ने ये इसको रिलीज किया, इस रिलीजिंग फैक्टर को. ये हार्मोन नहीं है, ये एक रिलीजिंग फैक्टर है. नाउ दिस रिलीजिंग फैक्टर विल go and send signals to your pituitary gland. Now your pituitary gland, the anterior lobe of pituitary gland will sense it. Now it will produce this hormone. And what is this hormone? ACTH. This is the adrenocorticotropic हार्मोन. ठीक है. So ये हार्मोन रिलीज होगा. So, what is the function of this hormone? This hormone is released by pituitary gland. So, this hormones will goes to adrenal cortex. Where is the adrenal cortex? This is the part of your adrenal gland. Your adrenal gland consists of two parts: adrenal cortex and adrenal medulla. So, you have discussed that these things in the previous anatomy. Now your this adrenal cortex will release other hormones: cortisol, glucocorticoids, mineralocorticoids, and androgen. These are the hormones which are released by adrenal cortex. So you know there is a connection between all of them and how they regulate each other. Okay, by producing it, it stimulate the other will produce another thing, then the other thing was stimulating the others and produce more and more hormones. So that's why our pituitary gland is called as master gland, because not only it producing these hormones, but also it stimulate the production of other hormones. Okay, so the production of these hormones is related with pituitary gland. So a patient whose cortisone, like consider, whose cortisone hormone is producing in less amount, it means some disease is happens, or something imbalance is happen in the pituitary gland. So this is very important for us. Now let's discuss that and other stimuli came. Okay, so and other stimuli is coming, hypothalamus sense it, and now it is going to release this factor which is called as growth hormone releasing hormone. ठीक है. Now what is going to happen? It again send signals to pituitary gland. Pituitary gland will release growth hormone. GH is growth hormone. Now, when the growth hormone is needed, when a person has a low growth rate, so usually the growths in our body start at the night time. Okay, so ACTH production is came in the early morning time, and it decreases in the late night time. So लेट अगर आप अर्ली मॉर्निंग में देखें तो इसकी कंसंट्रेशन आपकी बॉडी में ज़्यादा होगी, लेट नाइट में कम होगी. While the concentration of growth hormone in the morning is less, in the night it is very at high concentration. Now, what is the function of growth hormone, or what is the mechanism of growth hormone? It will goes to your liver and cause the liver to produce insulin like growth factors. Actually, these insulin like growth factors are responsible for producing the growth of your bones, of your muscles, and of your whole body, increasing the size of your body. Okay, so this was the mechanism of it. Now, another stimuli games. Let's suppose this stimuli is the stimuli number third. It will goes to thalamus. Now the thalamus is releasing this factor. And what is this factor? This is the gonadotropin. ठीक है, gonadotropin releasing hormone. Now this hormone again sends signals to the pituitary gland. Pituitary gland now will release two hormones. FSH. What is this hormone? This is the follicle stimulating hormone. And same time it is releasing the other hormone, which is this LH. This is the luteinizing hormone. These two hormones release at a time. And what is the function of these hormones? They hormones goes to your ovary, cause the production of maturation of your follicle. The FSH is causing the maturation of follicle, and LSH is causing the ovulation. So this was occurring inside the ovary, and after that the ovary is going to produce estrogen and progesterone. These two hormones will be produced out. So this was all about it. Now now the fourth stimuli comes to hypothalamus. Again the hypothalamus is going to release this and this at the same time. What are these factors? This factor is called as thyrotropin releasing hormone, and at the same time it is releasing dopamine. Dopamine is represented by Da. Now what is happening? These hormones are actually regulating the production of prolactin. They are affecting it. Okay, now your thyroprine जो है, this growth factor is stimulating the production of prolactin, mean it is increasing the production of prolactin. But your dopamine, this is a factor which is inhibiting it. So it is actually decreasing the production of prolactin. So why this happens? At the same time the increase in the prolactin happens, and at the same time the dopamine is causing the decrease in the production. So actually this is happens because our body is continuously release prolactin. And what is the function of prolactin? It is acting on the breast, causing the production of milk. Now, if there is a continuous stimuli of being producing the prolactin, and you know that there is no need to produce the milk every time, okay, so therefore we have to inhibit it. So this is the blessing of the Allah Almighty, that He has given us inhibiting as well as the stimulating action. So whenever we need the milk production, it will give the milk production, and whenever we don't need it, there is a mechanism to inhibit it. So this was all about the mechanism, that how these hormones are released out and how they act and what is the mechanism of their action. Okay, now we are going to start all of these hormones which I have given here. We will discuss their mechanism, and we will discuss that what types of drugs will affect them. Now let's start the first hormone, which is the adenocorticotropic hormone. This is this hormone ACTH, abbreviated as ACTH. Now, the what is the mechanism of their release? I have given you a whole explanation that from hypothalamus I have explained all the steps one by one and explained to you that how these hormones released out. Then their mechanism of actions came. You know very well that these hormones act on adrenal cortex, which is a part of adrenal gland. Now I have draw here adrenal gland. This outer layer, which now I am shading, this outer layer, this is the adrenal cortex. Adrenal cortex is the outermost layer of your adrenal gland. And the innermost layer of your adrenal gland, this is called as adrenal medulla. Now your adrenal cortex is going to act with it. Okay, now this is the membrane of adrenal cortex. Let's pause. Okay, this is the membrane of adrenal cortex. Now in the membrane of adrenal cortex already the cholesterol is present. Now when the ACTH, this adrenochromotrophic hormones comes, it will interact with this reaction, causing the conversion of cholesterol into prenolone. Now prenolone will convert itself into the progesterone, and progesterone will convert itself after various processes into a hormone which is called as cortisone. So you how now you have seen that how the adrenal cortex the cortisone is going to produce. Similarly these hormones are also produced. Okay, now what is the action of these cortisol? It has action of anti-inflammatory. Okay, it has action to increase the glucogenesis, mean increase the production of glucose, and it also increase the production of breakdown of protein, means proteolysis. So these are the actions of these hormones. And so this was the mechanism of action of ACTH. Now we are going to see that what are the drugs should be given when we have some types of disease, when we have more production of a hormone and less production of a hormone. So now we are going in the first we have discussed what is the normal physiology. Now we are going to start the pathology. That pathology means a disease. Okay? Now some diseases happens inside your adrenal gland that it is going to produce these two diseases. The first disease is Cushing syndrome and second disease in Addison disease. Okay? Now, what happens in this Cushing syndrome that the production of your adrenochromotrophic hormone is increased. Now, a normal concentration from the normal concentration, a more hormone is produced. Okay. Now, this is very serious case. Similarly, from normal concentration, your hormone is producing less. So, this is also a serious condition. So, we should give drugs to that particular patient according to their need. If they have high concentration, then the drugs are different. If they have low concentration, the drugs are different. Now we will discuss the both of the drugs which should be given in the particular case. Like in this case, when you have Cushing syndrome, you will give drugs to your patient, and this drug is called as mitotone. मिटो ठीक है, टैन है, मिटो टैन, मिटो मिटो हम तोते को मिटो कहते हैं, मिटो टैन. और what is the mechanism of action of this drug? That it is going to block the production of ACTH. ठीक है, and you know how the ACTH is going to produce from the pituitary gland. So it will block it, and by blocking it, it will decrease the production of ACTH. Now what are the drugs which are used in Addison disease? So in the Addison disease, the drug used which is called as corticotropin. What is the mechanism of action? It is increase the production of ACTH. So one is decreasing the production, other is increasing the production, but they have adverse effect of them. So what are the adverse effects? They can cause edema, causing the accumulation of fluid in your body cavities. Then mainly it is used for the diagnosis purpose. Okay? This drug is used for the diagnosis, not the treatment. It mostly it is used, the people have wrong conception that it is going to treat that Addison disease, but is not going to treat that. It is just going to diagnose that you have Addison disease or not. Okay. Now other adverse effects are that they are increasing the blood pressure and decreasing the concentration of potassium. One thing which I have written here, that the long half life of that drugs. Again, remember that these drugs are affecting on the hormones, so always they have very long half life. And they will be given, how they will be given mean the pharmacokinetics of them will be very simple, that drug administration will be done through injection, mostly through IM. I mean intramuscular injections will be given, and the intramuscular injection will be of depot preparation. Okay, so in order to give a very long half life of that drug. And mostly all of them make, what is the duration of them, so they act through months. Their duration is very very long, because they have to substitute the action of hormones of them. Okay, now we are going to start the second hormones, which is a growth hormone. Okay, let's discuss the mechanism of their release. So I have explained in the previous that how they are released, so I am not going to repeat that. I am directly going to mechanism of their action. I have explained to you that the growth hormone will go to your liver and causing the production of insulin like a growth factor. So insulin like growth factor 1 and 2, so they are the two factors which are released, and they will just do similar work as the growth hormone does. So they are increasing the growth in the body, nothing else. So this was the mechanism of action. Now let's discuss the pathology. So what is pathology? In one disease the growth hormone concentration is very high, and in one disease the concentration of your growth hormone is very low. Now, in the acromegaly, as this word indicate, is a disease in which the body parts increase their growth very high. Okay, so it will cause the abnormal production of your hands, foot, and other body parts. So, in this disease, the growth hormone is very at the high concentration. What are the drugs for it? Acreotide and lanreotide. Reotide is same. Ac or lan, oak or lan is same. Is to remember. One thing you have to remember, that the which are increasing the production of growth hormone, they are somatostatin inhibitors. What is somatostatin? It is a hormone which is inhibit the production of growth hormone. So if you give the inhibitor of it, it's antagonist you can call as, and its inhibitor will if it is inhibited, growth hormone concentration will increase out. Similarly, dwarfism is a case in which growth hormone decreases out, and the drugs for it is stomatotrophin, which will increase the concentration of somatostatin hormone. So now we are going to see what is the contra and indicated use. Means some people are using these somatotropin drug as a misuse. So some sportsmen are, they use this drug for the bodybuilding. So they want to increase their muscular strength. So therefore they will eat that drug, but it is the abuse of that drug. So they should not use them. Secondly, some people wants to increase their height, and for the increase of their height for a fashion, so they take their drugs, but it is not, should not be taken. This is the abuse of that drug. So this was all about this hormone. Now we are going to start the third hormone, and the third hormone is gonadotrophin hormones. So now let's go towards them. So the third hormone is gonadotrophic hormone. This regulating factor is going to release the two hormones, which are FSH and LH. So what is the pathology of that comes to it? Because you know the function of FSH, that it is controlling the maturation of your follicles. So after the is 14 days of it will mature your one follicle and degrade the others, and after that your LH luteinizing hormone will cause the ovulation. Ovulation is that the egg will move into the ovary, and after that these things are regulated by it, and the ovary is going to release estrogen and progesterone as a result of it. Now let's discuss the pathology of it, that some kind of increase in the hormone or decrease in the hormone happens. What happens when the hormones increases? You will use a drug which is called as minotropins. Minotropins are the drugs which increase the production of FSH as well as increase the production of LH. So it is increasing the production of both of these hormones. When both of these hormones increase, there is increase in the ovulation and increase in the maturation of follicles. Other some drug yeah also use, these are the drugs: urofollicotropin, follicotropin alpha, follicotropin beta. These three drugs only increase the production of FSH, only FSH, not LH. And this is the leukotropion, this only increase the production of LH, not FSH. Some adverse effect are also happens due to this drug. Multiple pregnancies are happening due to the taken of these drugs, and triplet and twins reproduction is also happening due to these drugs. Now let's discuss when the hormones decreases. So mostly these drugs are used because in lot of people there is decrease in the production of hormones. So the continuous administration of G and R एनालॉग. सो अगर हम कंटिन्यूस प्रेडिक्शन देते रहें, जो ग्रोथिंग फैक्टर है जो हाइपोथैलेमस रिलीज करता है, तो उसकी वजह से ये हार्मोन डिक्रीज हो जाता है प्रोड्यूस होना. सो हम कहते हैं ना कि वो डिसेंसिटाइजेशन होती है रिसेप्टर की. एक अगर बाहर बाहर एक ही एगोनिस्ट आता रहे तो वो डिसेंसिटाइज हो जाता है, वो ऑपोजिट रिएक्शन करना शुरू कर देता है. तो ये बिल्कुल वैसा ही है. सो अब ये ड्रग्स हैं जो कि कुछ GnHR के एनालॉग्स हैं, ठीक है. तो इनमें कौन कौन सी ड्रग्स हैं? ल्यूपोरालाइड है, गोसिरोलिन है, नेफासिरिलिन है, हिस्टीरिन है. सो इनमें जो ये ल्यूपोरालाइड है ये हमारी ओवुलेशन को कम करती है. सो एडवर्स इफेक्ट इसके क्या है? डिप्रेशन और हॉट फ्लैशेस. का मतलब क्या है कि चेहरा आपका सुर्ख हो जाता है. कंट्राइंडिकेशन, इट शुड नॉट बी यूज इन प्रेगनेंसी एंड लैक्टेशन. So you should prevent them because it is decreasing the ovulation process, which is very harmful for the fetal development. Second process is that we should give the G and R antagonist. We are going to give the antagonist in order to perform the reverse process. So for the reverse process we will use citrolix relix, a drug which is used for that. Now there is a last hormone which is the prolactin, and I have explained that prolactin is acting on the breast, increasing the production of milk. Now if the increase in the hormones, then you will give dopamine antagonist. Dopamine is going to decrease the production of prolactin. Now if you want to increase the production, then you will give dopamine antagonist. What is the drug for it? It is metcloparamide. If you want to decrease the hormone, then you will give dopamine agonist, okay. And the dopamine agonist drugs are bromocriptine and cybergolin, okay. These drugs are used. What is the adverse effect of them? You will observe the nausea, headache, and these minor adverse effect will happens. So this was the end of this lecture. I hope that you will like this video. If you like it, then please subscribe to my channel, like my videos, and also press the bell icon in order to get the notification of all the video which I uploaded. So thank you so much. Meet you soon in the next lecture. Till up, Allah Hafiz.